was honored to work with a number of the members of the Change Foundation back in the fall, and they heard me speak a little bit about what it's like to make change and make improvements, and also what it's like to sustain change in large health systems. So they thought it might be valuable for me to share some of the experiences that we've had with our team with the teams here in Toronto.
I think culture change obviously takes a long time. When we first developed our strategic initiatives back in 2016, we talked about improving the patient experience. Corporately, we're at a point right now where we would not leave it at that, where we would say improving the patient and the caregiver experience.
I think we've always struggled with having all the processes in place to make sure that the patient has a successful transition. We were leaving out the component of the caregiver. So now when we include the caregiver in those discussions, it's a whole different plan. So the culture of the organization is our physicians and our staff are learning that they can be more successful in helping patients transition home because they're having more intentional conversations.
The co-design events have certainly been a highlight. We see the power and the value of the family caregiver voice along with the providers there together in what that product then becomes.
The biggest highlight has been the co-design method. I didn't know anything about it, and it's just been amazing to bring the providers and the caregivers together to design solutions that work for everyone.
Caregivers feel that they've been forgotten and they're lost out there. When we spread this time to talk tool, they're going to realize that they're part of the team, and that's what I'm hoping for, that's just the way we do business.
It's been great to have the Change Foundation investment to help us accelerate this work in the organization, but we need and will have this become just part of the fabric of how we do our work now.
The big, hairy, audacious goal that I have, right, is that every healthcare provider, whether it's a hospital, primary care, secondary care, community care, that this is the way they treat and involve not only patients, but their caregivers involved. And in a perfect world, everywhere across the country, not just Ontario, this becomes the way of doing things.
It's improving just based on the fact that now caregivers are involved. They're involved, they feel a part of the process. We're part of the change, but we're also part of the decision making.
We are now, collectively as a group, we're constantly being considered in the process. To me, that wasn't the case 5 years ago, but I have a lot of faith and a lot of trust and a lot of belief that going forward, it will be the case.